My name is Stewart Donaldson, and I'm the Executive Director of the Evaluators Institute. And we're really excited to have our summer TEI webinar for you today. Another development of TEI is we have invested in an award that we are calling the TEI Social Betterment Award. And this was our first year, our inaugural year of the TEI Award. And if you go to our website, which I'm going to show you right now, you'll see the sort of focus of the award, the criteria, and how we run the process, which we are going to do in 2026, which will be our second award. But what we, in summary, do is we have a selection committee of leading practitioners and thought leaders in the field of evaluation. And we encourage people to nominate, colleagues, collaborators that they think really deserve this recognition of outstanding contributions to evaluation practice. And one of the great things that we've built into this is that we ask our award winners to have a opportunity to say more about their work in one of our TEI webinars. And we're really, really honored and, sort of excited to announce that Donna Mertens is our inaugural 2025 award winner. And we did give the award formally in Las Vegas a couple of months ago. But on our website, you can read about Donna's nomination and the people that wrote letters for her. And it was truly an amazing nomination, an amazing set of contributions to promoting social betterment around the world. Donna Mertens is a very prolific evaluation thought leader and practitioner. She is professor emeritus at Gallaudet University, where she taught research and evaluation for 31 years. She's also a past president of the American Evaluation Association and has been the editor for the Journal of Mixed Methods for 5 years. Her practice spans many different regions of the world, and she looks at topics like gender-based violence and how to prevent that. She does a lot of work in transformative mixed methods in diverse communities and has written a number of really well-cited and used books, including one that we use regularly here at Claremont in our master's and doctoral program on program evaluation theory and practice. And it's truly one of the most comprehensive books where you're able to learn about many different approaches that we now have in evaluation, but especially approaches that many other authors haven't brought into that discussion. And so we absolutely love it in our evaluation theory class, and I know many of the students that were in there are on our webinar today to meet you and hear from you live. So again, it's a great honor, and I'm now going to ask Donna some questions, and we'll begin learning about transformative evaluation in action. After we explore some issues together, you'll have the opportunity to ask your questions in the Q&A box at the bottom of your screen. So Donna, again, thank you. And maybe you could start by telling us a little bit about what is transformative evaluation.
Well, Stewart, thank you very much for that wonderful introduction. And you might think that I feel tired after hearing you describe everything I do, but actually it just gets me more energized to do more things. So I'm happy that I have that quality. Transformative evaluation is an approach to evaluation that I developed based on experiences of interactions with members of marginalized communities who said that the way we were approaching our methodologies weren't really getting at the issues of most importance to them, or they weren't collecting data in ways that they viewed it as being credible and valuable and serving as a basis for transformative actions in order to really make the world a more just place. And so I gave a lot of thought to what that should look like, and I adopted some of the work that Egon Guba and Ivana Lincoln did early in the world of evaluation related to paradigms, because their work was making it very clear that our methodological choices are based on the assumptions that we bring into it. And so transformative evaluation really is defined by the assumptions related to what is the meaning of ethics? What's the meaning of values? What's the nature of reality? What's the nature of knowledge? What's the nature of relationships that we have with the people in our study context? And then once we clarify those things, then how does that influence the decisions that we make methodologically? And so transformative evaluation is that approach that comes from an axiological assumption about the nature of ethics and values that says the very first and most important thing is that we need to design our studies so that they do address issues of discrimination, of oppression, of justice, of human rights. And then, whenever I say that, then my mind always just goes right back to saying, well, what does that mean methodologically? How would I change the design that I maybe started out thinking this is the way I'm going to approach this evaluation if I make that assumption that to do an ethical evaluation, I need to be very explicit that that's what I am trying to do. And included in that then also are the concepts of being culturally responsive, of giving back to the communities that we do the evaluations with. So the concept of reciprocity. And that can include things like building capacity. And, as I say these things, I hope you're seeing that the building capacity means you include that in your design. So methodologically, we say, well, how do we do that? How do we bring that in? And if we have an assumption about the nature of reality, is called the ontological assumption, then what does that mean? And I'm going to use a very current example right now that the NSF, National Science Foundation, has been given a list of over 100 words that they've been told if these words are in those proposals, they should not be funding them. And they include words like disability, like culture, like discrimination, like oppression, like gender. Words that they do not include are white, male, able-bodied. And so that is a version of reality. If we, the first category of words that being told you can't use those words, um, what version of reality is that? To me, that's a version of reality that rises up from the voices of those who experience that discrimination. And if we say the only thing that we can uh, talk about, fund, act on are things that don't include those words, then what version of reality is that? And where does that come from? And so if we accepted one version of reality, we would be able to work towards addressing those root causes of discrimination. If we accept the other one, then we're left with saying, well, we just have to kind of do generic work. Like we can't really recognize that some people really have been left behind, using the words of the United Nations and the Sustainable Development Goals. And if we look at epistemology, the nature of knowledge and relationships, then from a transformative view, we'd be talking about valuing knowledge that comes from all the full spectrum of stakeholders. So not just the experts, but experts in community, recognizing that those voices need to be brought in, that the community-based knowledge needs to be brought in. What does that mean in terms of our design? How do we change the design because we value that? And then looking at, well, if we're going to value that knowledge, how do we structure relationships so that we can provide a safe environment for people to share their experiences. So it is a challenging of the traditional power structure to say, how do we restructure what we do so that all the voices can come in and the value of their knowledge is there. And so it's those assumptions about values of ethics and knowledge and nature of reality that lead to the methodology that I would then describe as transformative evaluation, using that transformative lens to reflect those values, to reflect those assumptions. In my experience, it means that you're going to benefit from setting it up so that you have opportunities for dialogue, and also in my experience, the use of mixed methods, that is the combination of quantitative and qualitative, because it's a complex picture that you're building when you use this approach, and having the value that's brought from both quantitative and qualitative data and being able to put it into conversation with each other, I think gives you that opportunity to understand things better and to provide data that's going to be viewed as valuable by your different constituencies. So I think that's kind of a glossed over version of what's transformative evaluation.
Well, thank you. That was wonderful. And it partially answers my next question around, why did you develop that? This seems to be, a very different approach or model than some of the earlier, models that didn't, take a lot of these issues into account. One of the things that, I get asked a lot about the different approaches, when I'm teaching about them is, how do you navigate um, working with funders that might have more traditional views or even interest holders that we're working with? And I think that question, gets ramped up a whole new level, given what you said earlier about, funders and the government and so forth, not even allowing us to use some of these words today. So what advice do you have about how do we navigate this in the time we're in?
Well, Stewart, before I get into that, which I do want to get into because it is a super critical question, I did want to just provide a little insight into where it came from, because yes, it comes from my value system, but that value system was shaped in my childhood, where my family lived in Washington State. And in that context, all I ever saw were people who looked like me. And then when I entered seventh grade, we moved to Kentucky, and all of a sudden there were many people of color. And I could see as a child, really, that the people of color were living in conditions that were not as nice as the ones that I was living in. And this was in the 60s. They weren't going to my school. We still had segregation at that time. And they certainly weren't going to my swimming pool. And so I asked my teachers, why aren't there any people of color? I don't know exactly which word I used, in my school. And they said, well, honey, they just prefer to be with their own kind. And I just thought, I didn't know the word cognitive dissonance at the moment, but I thought there's something wrong with that picture. And so it was the era of the civil rights. And so I started, as really through youthful eyes, thinking like an evaluator and saying, well, is the civil rights movement making any difference? And so holding on to that curiosity about that, and my sense that this there are injustices in this world. I moved into the world of research and evaluation, a world that I think I was so pleased, it just fits me so well. People were arguing about, is quantitative better, is qualitative better? And then when I saw the work of Guba and Lincoln, I thought, well, wow, we don't have to have that argument. We can talk about the assumptions that lead us to make decisions. And so it was really thinking like that, that led me to start approaching work where I could say, all right, what I want to do now is to work with people in high poverty areas, or women in the workforce, or people with disabilities, or people who have dropped out of high school, things of that nature. And then I made a choice to go to Gallaudet University, which many of the people may know is a university for deaf people, because I figured what was missing from my knowledge base, experience base, was being integrally involved with a community that experienced discrimination on a daily basis. And so I entered Gallaudet thinking, well, I have all this experience in doing research and evaluation, so I'm going to teach. And the students weren't really positive. They weren't really receptive to the methodology as I was teaching it. And in essence, what they told me was, well, Dr. Mertens, you just have to understand that research and evaluation has always been used as an instrument of oppression against us. It's never been one where we are the ones who have decision-making capabilities of what should be studied, how it should be studied, what language should be used, and so forth. And so rather than going, all right, then I guess this is the wrong place for me, I said, well, why don't we talk about it and figure this out? And so that was really the origin of talking about a transformative approach, was to say, if I think I'm doing good things, but it's not having the good effect, or not being perceived as positive in the communities that I think I want to be serving, I got to make some changes. And so I just wanted to share that little bit, because I do think that we are, at least, when I was reading methodology textbooks as a graduate student, these kinds of ideas, as you said, they weren't in there. And so I think, a lot of times we hear that a good heart is just not enough. We need to be critically reflective about the impact of what we're doing. So to move on to your next question about what are we going to do now in these very different times, my my position is that you simply cannot leave your values at the door when you walk in as the evaluator. That if these are the values that you hold, then you bring them in. How do we then continue to advocate for the things that we feel very committed to when we're in a hostile environment? And that is there's no simple answer to that question. In my experience, I have always found that it's best to ask critical questions as you begin the conversation with a funder or with a PI or with your first point of contact for an evaluation, and that those questions generally are about the representation of voices. If this is designed to help this particular community, then how are those voices brought here? Is that, you know, is that by raising that question, are we saying then we should discriminate against people who that program is not specifically designed to serve? No, it's saying what we need to do is to look at the context, the historical context, what's been going on, what has led us to be in the status that we're in, and what can be done. And so my questions generally are about representation. They're about the plan for the use of the information, because if that evaluation data is not being used, then that really violates my ethical concerns. I don't want to be the person who gives a survey and analyzes data, writes the report, and then puts the money in the bank and walks away. And I hope somebody does something like that. So to be able to raise those kind of questions about how will we build in the opportunity for use to address the challenges that school systems, health systems, environmental systems, wherever we're doing our work. And it's really hard for a funder or a project director to say, I really don't want to have impact. I don't.
Yeah.
And so I do think that's kind of our secret power as evaluators, is to be able to raise those kinds of questions and just shift thinking so that they can see value in bringing more of this perspective in.
Great, great. Yeah. And thank you for your personal story and journey. That was very impactful. I really appreciated that. Um, well, we, wanted to make sure we, gave people some, sense of, what this looks like in actual practice. And so I'm wondering if you could share with us maybe one or two of your favorite recent projects, and give us a sense of how it plays out in the world.
Well, Stewart, it's kind of like asking a mom which one her favorite child is. But I will share a couple of examples. For 5 years, I was working as a consultant with Healthy Start. Healthy Start is a nationwide program that was designed to address disparities in maternal and infant mortality in communities of color. And in this initiative, which had locations in all 50 states and in all the territories, it existed for more years than I was a consultant to it. Up until the time that I started working with them, the data that was collected essentially was quantitative indicators. So they would have questions like how many women went to the doctor, how many women drink, how many women smoke, questions of that nature. And they weren't seeing big improvements. And at the time that I entered, the death rate in infant and maternal mortality for Black communities was 3 times higher than that for white communities. Remember, this is in the United States. This
Mm.
is not a developing country. And I mean, I can hardly even say those numbers. When people say, oh, qualitative, you need qualitative for really the emotional side. But those numbers make me want to cry. I'm just like, if we've had this, if we've seen this trend, what needs to change and what's being done. And so that is really what they asked me to do, was to work with their chosen consulting firm to do the evaluation, to guide them to add a transformative component to the evaluation plan. And so they continue to collect the quantitative data. That part didn't change, even though I kind of intimated that some of those questions seem like they're kind of blaming the victim questions. It's your fault that you didn't come to the doctor. It's your fault because you were smoking, versus taking a more contextual look, a more historical look that says, how did Black women come to live in communities that have higher rates of violence, higher rates of environmental toxicity, less access to health care in places that may not be easily accessible to them, that have staff that may not understand their communities and the context that they live in? And yet we had knowledge about that. We had knowledge about women's experiences, and it wasn't being brought into that project until they added that as a component. And so the evaluation design then added a case study approach in selected communities that said, let's look at those issues. Let's look at the cultural mismatch, shall we say, which is kind of a benign way to say it, between the health community and the Black women who are attempting to get these services. Let's look at their access to nutrition. Let's look at their access to transportation. Let's look at their feeling about interacting with the health system that historically has not been positive toward communities of color. And so when they took all of that into consideration and they were able to modify the evaluation to collect that kind of data, then they started using it to modify interventions where they worked with community groups and said, how can we give support to women so that when they do go to the doctor, they feel like they're safe and supported and listened to? And that changed the intervention. So, that's just one example where, I just feel really blessed that I was able to have that kind of input into what they were doing, and that they did make those changes, and we were able to see that things were being done differently. And unfortunately, with the current administration, that funding program has been cut, which might be for obvious reasons because it contains a lot of those words I told you that funding agencies aren't allowed to use. I could share one other example, because this one is more in the international context, and a lot of my work has been done in the international context. I've worked in over 100 countries, and it's always done by invitation by someone who says, we have this human rights issue. We think maybe you're a good person to have and come and talk to us. So would you consider doing that? And so that's how I get into those countries, but it has to be with someone from the country who says, this is important to us. We want to do work on it. Could you come and we'll work together? And so the UN has a group called the International Fund for Agricultural Development. And this is a huge operation that has more than $1 billion portfolio designed to provide agricultural support for the poorest of the poor in a sustainable environmental way. Okay, so you can see those values really resonated with me. I was like, yeah, I'll definitely come and hang out with you guys. And so they asked me to do two things. One was to work with them on the revision of their evaluation manual, which was very good, but it did not get into these nuances of cultural differences, linguistic differences. What difference does it make in terms of gender, If you're trying to support farmers, are you only supporting male farmers, or are you being inclusive of women? What are the considerations if people have disabilities? Is there any support system within the EFOD, the International Fund, to ensure that the grants or the loans that they're giving, they give both loans and grants, are going to diverse communities. And so I was able to get them to look at that manual and make modifications in how their people were being guided to do their evaluations in a global way. And as a part of that, then they asked me to be a part of they had a system-wide assessment of their approach to gender. And so I was able to work with them and really raising issues about gender not being a binary concept. That it's not just males and females, that if you're actually trying to do things, you might need to be conscious that certain groups who might be members of a sexual minority community may not feel safe coming out and going to town meetings and expressing what their needs are. And so I help them to think this through in a way that gender could be looked at as a multidimensional concept, but also as one where they had to give consideration to intersectionality. So, as we well know, all men are just not all men, not all men, and all women are just not all women, or not all women. If you come from an area of higher poverty, if you have a certain religious affiliation, if you have a type of disability, all of that is what constitutes that intersectionality. And so I was able to be a part of a team to inform from the beginning that they needed to give consideration to these aspects of diversity, and that would have methodological implications for how they went about collecting their data, who they involved in the decisions about data collection, the interpretation, and the use of that data. So to me, that was a really exciting opportunity to be able to work at a global level.
Okay, well, those are two really powerful examples of, making a huge impact on social betterment. And thank you. That first one was especially moving to me, and it really helps me see the value of how you select projects, how you stay the course. A lot of people, once they start hitting all the barriers, or the desires that don't fit their own values, it's easy to give up. And one thing, from knowing you and hearing your presentations, you're very clear about what your values are, and what you're there for, to help the oppressed, and make an important difference. My last question, and then we'll go to questions that are in our Q&A box. So if you have questions, please begin typing those in. If we could now look into the future, our field has evolved. We've gone through different cycles in society. And the transformative approach has been a big, I think, development to the field, and really opened up a lot of different views and opportunities, and so forth. But if you look 5 years out, what do you think the future of our field of evaluation is going to look like, especially through the transformative lens?
Well, Stewart, this question kind of goes back to your question related to the current conditions that we're in, and how do we continue to function in a way that aligns with the values that we hold. And I do think that's the question of the hour. And so one answer, which would be very glib, would just to be to dig a hole and stay in it for 4 years, and then you come back out and you start work again. But of course, I'm not going to do that. I'm old. I've got to keep working. I have to value every single day. So I wanted to just talk about some of the thoughts that I've had, ways that I see the transformative work evolving, because this is not something that I said in 19 whatever it was when I first published something about it. But it changes because of understandings that are growing, and a lot of those understandings are coming from communities to guide our thinking better. And so I think one of the biggest things that I think can help us, especially at this time, is to look at that epistemological assumption and say, how are we structuring the engagement that we have with the stakeholders? Are we doing it in a way that is truly inclusive, that values their experiences, but even more than that, that enables them to build relationships amongst each other, so that when the evaluation ends, and it will, they are still together and they have the knowledge, the skills, the experience, the commitment, the desire for change that our evaluation has provided, kind of that groundwork for them to continue to work. So we could call it coalition building, we could call it collaborations, we could use a lot of different kind of words for it, networks. But I think that is going to be really key, because if you watch the news about the protests, at the No Kings protests, you saw so many people, and that's the strength. It's so many people who care deeply about these issues. And that's how we're going to keep them alive. That's how we're going to keep the progress going. And I wanted to cite one example of someone who's doing that very, very well. It's a project, again, that I had super wonderful opportunity to be a consultant with. It was called iPage, and it's an NSF-funded program to increase the representation of people of color, sexual minorities, and people with disabilities in leadership positions in science museums. Travis Sandlin is the PI for that project. And I tell you, it was just a pleasure, because they took this concept of building coalitions, networks, relationships to a point of perfection that I rarely see in evaluation work. So that even though NSF will be ending its funding at the end of this quarter, they have people that they have trained across the nation who have now these skills, not just to be leaders, but to build other leaders. And so I think that's got to be such a huge thing that we give a lot more attention to in the way we set up our studies. And I think the other thing is, I talk about the transformative paradigm, and that is the place where I put most of my eggs. But, it's not the only paradigm that we have. And so I think there's really fruitful ground that can be cultivated by looking at what I might characterize as permeable borders between the paradigms. So bringing the indigenous paradigm into conversation with the transformative paradigm. I've done that a little bit with Bagele Chalisa in Botswana, with Fiona Cram in New Zealand, a part of the Maori community. But I think looking at how do we bring these concepts, because when I first proposed this concept that it should have, going back to evaluation roots and Marv Alkin's book, And he and I had really long conversations about, do we need a social justice branch on the tree? And he would say, no, it's just values. And I would say, okay, Marv, as soon as I see social justice on all of those branches, then I'll say we don't need one to ourselves. But that's what I would like to see. I would like to see social justice come into all of the other ways that we understand doing evaluation. I think that would make us all stronger. And we have a lot of people who are working on those kinds of things. The culturally responsive evaluation community is very strong, and they are putting forth ideas that they have the potential to lead us to better places. And so looking at that, also understanding better how to use mixed methods, how to bring the quant and qual together in ways that really stimulates action. So not just an integration where you say, oh, I got better insights, but how do we bring it together so it really stimulates action? And I think that's another critical thing. And then the final point I'll make is that if we can start focusing our attentions on what might be characterized as the root causes of disparities in society, I think we have a better chance of making progress than if we work from more of a superficial level of saying, okay, well, we'll teach, and I hope this doesn't offend anybody, we'll teach everybody to meditate and then they'll all feel better and then we'll be able to feel better about everything. But what are the root causes? What's going on? I mean, if you look at schools and you see how many people are leaving, how many of the teachers, the psychologists, the staff are leaving because it's so stressful. Teaching them to meditate, to be mindful is a nice thing, but it doesn't change the root causes of that stress and their exodus from our school system. So I do think those are areas that as evaluators, we can have some impact into the future.
Okay, excellent. Thank you so much. So I'm now faced with a dilemma of many good questions to select from. And so I want to thank you all for typing your questions. We'll probably only have time for two or three, and I'm gonna have, select some out that I think, really will resonate with the, conversation and people's interests. So the first one is, how do you see your work connecting with indigenous and decolonizing methodologies?
Okay, well, I'll tell you, this is a good moment for me to show you a quality that all good evaluators should have, and that is humility. I'm not Indigenous. I work with many Indigenous scholars because I believe that the ideas that they have will benefit all of us, and I want to learn from them. In my earlier writings, I thought that Indigenous could be subsumed under transformative. I had some moments of consciousness raising where it became very clear to me, and the Indigenous people might go, well, why didn't you understand that in the first place? It's, we all enter context with our cultural blinders are until we have some opportunity to have those scales fall from our eyes. We don't know that we haven't been accurately representing the voices of a community that we do not represent. And so my understanding of the Indigenous assumptions has grown through these interactions. I can see clearly from their scholarship how they have different kinds of assumptions, that their views of what is ethical, the nature of reality, epistemology, is very deeply rooted culturally. in their Indigenous communities. And it's different from the way I had perceived the world. Now, saying that, I think it's really important for me to say first, I continue to interact with members of Indigenous communities. I'm right now part of a writing group from the Caribbean who is formulating a Caribbean Indigenous approach, which has not been in the literature previously. I don't pretend to be the expert in what they understand in terms of the effects of colonization in the Caribbean, the culture of the Caribbean, the methods that are culturally appropriate in that community. But I can be supportive of them in guiding, supporting, writing, critiquing, trying to provide access to avenues for making visible the work that they are doing. So I think for me, that's a large part of what I'm doing is building those relationships, being supportive, trying to get that work out there in a very visible way so that the methodological community pays attention to it. Also, learning from them and integrating concepts that they have held probably for centuries, eons, I don't know, that we hadn't really considered to be that important in the work that we were doing because it wasn't part of our methodological thinking. So just take the concept of spirituality. I mean, when I was getting methodology books, it was very clear that that doesn't fit. This is science, this is, we might say, religion or spiritual matters or whatever. They don't fit together. But when you talk to Indigenous people, they say, but spirituality is a large part of who we are. And I don't care if you're Indigenous or not, if you start to contemplate the connectedness that we share with the world, with everything, with the air, with the water, with the mountains, it makes you much more attuned to trying to be the person who supports positive change that encompasses all of those aspects. And so, yes, I'm not Indigenous. I'm not a person who can speak authoritatively about the meaning of being an Indigenous person, but I can learn from them and I can be supportive and I can look for opportunities for us to, as I said before, have those permeable borders.
Okay. Wow, thank you. That was a very humble and insightful way to think about that topic. The next question is, what are some of the main ethical challenges you've encountered doing transformative evaluation, and how did you resolve them?
Okay, yeah, that's a super good question. I think something that still resonates for me is entering a context and noticing that there are voices that are absent. And so if I enter a context that says, this is a project that is designed to improve the training of teachers of the deaf across the nation, and I walk in and I notice that there are no deaf people in the room, I feel I have an ethical obligation to raise that as a question. And so this, you might guess, is actually something that really happened. And so I did say, where are the deaf people? And that goes back to the power of the evaluator to ask those little questions that, I call provocative questions. And at that moment, that principal investigator said, well, Donna, we have to work with the willing. And I said, well, just a moment, let's try to think about the meaning of that word, the willing. Who is that? Are those people who communicate like I do? So it makes it more comfortable for me because we can all just talk and we don't have to worry about that other language. And I said, it's true, I'm just the evaluator. So I could never usurp the role of the principal investigator. That's not my job. Can't say really you ought to have those people here. But I will notice in my evaluation if this is really a hearing-centric project that doesn't have engagement with the deaf community in a real way. Well, you know what? That project transformed. So it evolved to where there was always a hearing deaf team to head every part of the initiatives in that project. So to me, that was an ethical issue that just had to be raised. Sometimes ethical issues arise, I think, because we all don't have perfect insight into how others are perceiving us. And this is something that Hazel Simonet, another excellent evaluation scholar, raised. Do you know how you are being perceived by the community that you are there to work with or to help? And so there have been times when I have moved forward with things, but then been called out by saying, I don't think you really got it. And so for me, that also is an ethical challenge, because if I go forward with that, then I risk misrepresenting what the true problems, the true issues, the true experiences are. And so for me, it is an opportunity to say another good quality for an evaluator is to be critically reflexive and to learn continuously. And so then having those sometimes very difficult conversations, sometimes they even lead to tears. But if you're committed to it and you have the values and you say, no, I'm going to see this through, then you do the work. So I hope that gives some insight into things that I've experienced in ways that I've worked through those things.
Okay, excellent. Thank you so much. We do have time for one last question, and then we'll need to wrap up. And past AEA President Tom Grayson has a question for you. I believe equity is a concept with diverse meanings. For example, equal opportunity, fairness. Do you think there are differences in the meaning of equity?
Hi, Tom. Thanks for the question. You always were this really deep thinker. Appreciate it. Yes, like most of the terms that we use, there are multiple meanings attached to it. For me, equity means that we don't give the same thing to everybody and call it fair. Because I'm sure many of you have seen the cartoon of the kids standing on the boxes trying to watch the baseball game, and one can't see over the fence and he's very short. Or you've seen the example of having an intelligence test, how well you can climb trees, and the occupants are elephants, monkeys, and lambs. And so, is it fair to give everybody the same thing when the needs are so different? And so to me, equity it requires a deeper understanding of what the needs are, what the basis of those needs are, so that we can give appropriately to those who haven't had access, haven't had opportunities, haven't had resources that could bring them to a point where they can feel that they are living in a world that is just. And so that is, when I look at equity, I try to think about it as, what is it that's contextually necessary here to contribute to increased justice, rather than saying, let's make sure everybody gets the same thing.
Hey, well, Again, thank you. And let me say thank you to the 200 people that came into our space this past hour to listen to us talk about this really important issue of transformative evaluation in action. This great discussion is another form of evidence of why you're so deserving of our, first TEI Social Betterment Award. And we hope that you'll continue with full energy doing this very important work out in society in the US and across the world. So join me in thanking Dr. Mertens. This was absolutely wonderful. And hope to see many of you at the TEI trainings next month. And until we meet again, be thinking and doing what you can to promote social betterment. Take care, everyone.
Thank you.